after you gown and glove your surgeon, which is Candace here, we are going to move on to draping. So we're gonna drape as if this is an appendectomy with a laparotomy drape. I'm starting with the squaring off. What you see here is the 4 towels. There's gonna be 2 different ways to do this. With 4 towels, I'm gonna hand off 1 at a time. See that how I'm holding all 4, but I'm handing 1 at a time. Now I get the other one ready. While Candace puts that on, and we do the same thing for all 4. And then, I don't know, do you want to keep going through? Mm-hmm. Okay. Okay, now what you're gonna see often, may I come on over here? What you're gonna see often is the paper disposable drapes. So you'll have 4 stickies. The best way to do this is 1 at a time. I'm gonna take 1 sticky and remove and hand. While the surgeon's doing that, now I'm gonna get the other one ready. Keep going, just 1 at a time so they don't all get stuck together. Okay, last one. We're then gonna move to our 3/4 sheet, and this will be used as a down sheet. I grabbed it like a book. This is the folded end here. I have the open end, that's in my right hand. I'm gonna open this up to the center. So there's a lot of areas that you can open this, but you need to go right to the center where we have these 2 ends here. I'm gonna hand 1 end to Candace. We cannot come too low. I don't wanna contaminate. And then I'm gonna take the other end on my side. See how we're still hovering above. We're gonna pull 1 end out, and like at Candace's nice cuff there, you're gonna make that cuff every time you're putting a drape down. Big important thing, do not follow this drape down. See how low I am? When we came here, we let it go. Okay, you don't want to drop too low. Now we go to our lap sheet. You see the adhesive here. I'm going to ask my surgeon, would you like me to remove the stickies or keep it on? Remove the stickies. So I'm going to take that off. That's garbage. I'm making a pile of garbage here. I'm holding it again in that same book position with the fold or the spine of the book that's going to go on to the patient. You can see there's always going to be a picture that tells you which way is the head and which way is the foot. Can you see that, man?
Yep.
Okay. So now I rest it over our incision. The surgeon's going to take their half. Again, we want to make sure that we're not coming in the wrong spot. We want to come in the center there. You can see the 2 arrows. Now we're doing that same movement, pulling them away from the patient. Where am I? We going up or down first? Down. Okay, down. Now, bring it all the way down and drop. Come up here. When you go to put up, I want to make sure that you have a cuff here. Okay? Your hand has to be within that cuff. The reason for that is anesthesia is behind there and is going to grab that drape from you, and you don't want your hand exposed for them to grab. So we're considering that whole area unsterile. We're staying inside, okay? We're going to drop it now because we don't have anesthesia. Okay, at this point, the surgeon is going to start to prepare the bed. Let me back up just a second. I'm going to come over here and bring over my Mayo stand. I'm pulling the Mayo stand up to the bed. If I need to adjust it at this point, I do. Does it need to go down or up? If it's going down, I'm making sure I'm not hitting the patient's legs. Surgeon will start with the handle covers, the light handles, and I am bringing my back table over. Notice how I'm moving the back table. This is absolutely incorrect and will be contaminated. Hands on top, and I'm dragging it over. Okay? All right, now we start. That's actually the end of that one, isn't it?
Yes.
All right, now we're going to start. Keep going. We're going to start with passing off cords. Good way to start with cords. These can get it can turn into like spaghetti and get super tangled. So what you want to do, I start with the bovie because it's the first thing that'll be used. Notice that our bovie's up top. That's the first thing you're going to do is recognize where the bovie is. Are my glasses all tilted?
Yes.
Fix them, please. It's making me crazy. Thank you. Thank you. Sorry, everybody. Okay. First thing you're going to do is see where the bovie, so our bovie is up to the right. So what I'm going to do is make sure I have enough distance. I give just a little bit of room past. Here's my incision. I know it's going to be used there. I give myself a little bit of room after. Now, see how it's starting to get tangled here? I want to make sure. What happens is when you're in a hurry, this can get real tricky. If a surgeon's waiting for you and you're undoing knots, that one I'd leave right there.
Mm-hmm.
I'm going to bring this cord over and drop it over the edge. Ideally, if there's a nurse right there, I'm going to hand it to her. Don't just drop it, or him. Don't just drop it if they're standing right next to you. Now this drape is nice. It has little holders for us, so I can put it through there to make sure that it stays on top. So far, so good?
Absolutely.
I'm going to do the same thing with the suction. I start with my, oh, they're all just in a big knot, aren't they? Okay, I start with my distance to make sure I have enough. I can actually put this, go ahead. Okay, so now we put it through there. Same thing, we're making sure that we're not losing enough length. You can't, this cord cannot go past here and then we pull it back up. That's considered contaminated. So we're gonna that's why I'm establishing our length here first. So we have enough, but not too much, okay? We can also put a non-perforated towel clip, which I don't have, so I'm gonna use an Alice here, just to secure it in place, okay? We also have a pouch that we can use, so the surgeon most likely would have it if they're a right-handed surgeon. We'd put it, where would you like it?
I'd like it down here.
Okay, we're gonna get it out of the way. And that bovie can go there. Okay, man, get a nice shot of that right there. Okay. That's passing off cords. Can get a little bit tricky, you can get tangled. Best way to do is just stay with it and get help with your surgeon if you need it. Okay, moving on.
Time out.
Time out.
Okay, time out. Patient name is Joe Smith. He's here for an appendectomy. There are no known allergies. Antibiotic given is 2 grams of ANSAF. Any surgical or anesthesia concerns?
No.
Surgical concerns? Anesthesia says no, no concerns.
This patient is a fire risk 1. Do we all agree?
Agreed. We agree.
Okay.
Okay, after timeout, you always pause for timeout. Don't be doing anything while the rest of the room is timing out. Your job at that point is to listen to every word that they're saying. Once we've gotten through the timeout, now our surgeon's going to start to ask for instruments.
Local.
Okay, local. I have my local here. I have it labeled. What I'm going to do is take the cap off. I'm holding this just like I would a scalpel. Notice how the blade is out there. My hand is protected. I'm going to tell the surgeon this is 1% lidocaine.
Sharps down.
Once that sharp's back, the first thing I'm going to do is come over here and cap it without using my other hand. I'll leave that aside and ready for my next thing.
Knife.
I have that nice protection that we talked about, the cage that we talked about, and I am going to hand to the surgeon.
Sharps down.
First thing I do is collect that sharps and put it right back in the position it was.
Pickups and Kelly.
Pickups. Pickups are handed in a similar fashion of your scalpel. I'm grabbing it on top with those 3 fingers, and I'm handing it just like I did the scalpel that rests on top of the surgeon's hand. What else did you like?
Kelly.
Kelly, remember this move? The instrument should be closed. It's up and down, and I can move it anywhere I want. I'm going tips down.
Raytech.
Always open up a Raytech at least once. Surgeon might ask you to do more than that. Notice while after I handed that, I'm grabbing my instruments and putting them back while I'm waiting for the next thing.
Peon.
That's not closed. tips down.
Alice. Retractor. Kelly. Pickups.
This hand, see while I'm moving. So while Candace is still asking for things, I'm collecting with my right hand.
Local.
Okay, she needs more local. Now at this point, remember, if I have a minute, I have to draw that back up to go back to 10 cc's. And then I'm doing the same thing, cap off, and I'm passing this 1% local very carefully.
Sharp sound.
Okay.
Suture.
Okay, let's talk about suture for a sec. Come on over here, Dad. Can you see this? Suture, I have my needle holder and my suture. Suture is loaded. I'm gonna grab the needle about right there. It's about the bottom third of that. I clamp it closed. I'm gonna pull it out, all of the suture out of there. I wanna make sure that that suture doesn't fall below the table. So I'm gonna hold it in one hand. So right now I have in one hand, and exactly how you hold those other instruments up at the top. And I'm gonna hold the suture with the other hand so it doesn't get in the way. And when I pass this, this tip is going towards the surgeon.
Kelly. Tissue.
Tissue. I'm gonna drop this down so I know it's safe, so it doesn't drop below the line. Now I'm gonna anticipate, as she's doing this suture, my guess is she's gonna have to cut that. So now I'm ready with straight mayo.
Scissor.
See how I'm constantly picking things up and placing them back.
Needle back.
Okay,
Needle.
awesome, thank you. I can leave that on my mayo. I can bring it back here, back to my sharps. I can leave it, if we think that doc's gonna use it again, I can keep it loaded and not cut off any of the extra suture. I can place it in my, if I think that they're done with it, I can place it in my needle box and cut the leftover tail, okay? All right, what else, are we covering everything? I think that's good for right now. All right, thank you, we'll be back soon.